health and medicine in America. He comes with us with a broad a range of experience and expertise. He's been quoted in many newspapers. He was named one of America's top influencers in aging by PBS's Next Avenue, alongside Michael J. Fox and the former Surgeon General Vivek Murthy. So he's out and about, and he speaks for family caregivers as well, based on the connections and knowledge he has about the specific needs of individuals that work in this important role. He's from South Texas and graduated from Georgetown University. And with that, I am going to turn the time over to Jason. Jason, I cut into a couple of minutes of your time, so sorry about that, but we are so looking forward to hearing from you and learning. And thanks to all that are here, and appreciate your introductions in the chat as well. So Jason, I'll turn it over to you.
Excellent. And please bear with me while I share my screen.
I can't hear you. Let's see here.
Let's see. Can others hear me?
I can hear you, Jason.
Okay.
I can hear you. We'll figure it out on our end.
I can hear you.
Excellent. Okay, so I'm going to share my screen. Can folks see my screen?
Great.
Excellent. Well, thank you so much, Sarah, for that kind introduction. And if I'm a movie star in Sarah's eyes, that means everyone needs to put movie recommendations in the chat for Sarah. But I really appreciate the kind introduction, and thank you to Edwina and the entire ICA team for having me here today. It's truly an honor to be with all of you. I've really enjoyed watching everyone engage in the chat. I know all of you understand firsthand what it means to show up for those you love, for people in your lives, what it means to care. Whether you're a caregiver yourself, a service provider, or an advocate working to make Idaho a better place for families, your work matters tremendously. And today, I want to share some data that I think can help you in that work and help you better understand how your personal contributions every day fit into a much bigger picture and a movement around caregiving. As Sarah said, I'm Jason, and I lead the National Alliance for Caregiving. I'm also the son of a sandwich caregiver. I watched her juggle my care for my grandmother alongside raising me and my siblings. So this work is deeply personal to me, especially now as I take on the role of a father to an amazing 4-year-old. I see just how connected the care that my mom provided for my grandmother and the care that I provide for my son is part of a continuum of care that holistically is undervalued and undersupported. And that's why conversations like today, conferences like today, are so critical to changing that reality. Before we dive in, let me briefly introduce the National Alliance for Caregiving. Established in 1996, NAC is transforming how we value family caregivers through our research, advocacy, and narrative change work. Our extensive network includes organizations like AARP, the American Cancer Society, Johnson & Johnson, US Aging, and many others. Together, we work across sectors to support America's family caregivers and push for the systemic policy changes that we need in order to ensure that communities have the capacity, the resources to help people care. And core to advancing this mission is having credible data to accelerate the policy, practice, and culture change that family caregivers deserve. That's where the Caregiving in the US project comes in. This is the nation's deepest dive into the day-to-day challenges confronting family caregivers of older adults and people with serious illness and disabilities, children with complex care needs, you name it. We conduct this research in partnership with AARP and has become a critical tool for policymakers, journalists, and advocates across the country. For nearly 3 decades, 28 years now, we've been tracking America's family caregiving landscape. This research provides real insights into the impact across diverse populations that care takes. And it has become an essential intelligence for leaders shaping family caregiving policy in practice at the federal level, and at the state level. And as many of you might have seen in the media, on America's care crisis, caregiving has become a national conversation. And our data gives the caregiving community the ammunition it needs to drive change at every level. So let's jump into the findings. And I want to start with the big picture because the numbers are staggering. In 2015, we estimated there are about 43 million family caregivers in America. By 2020, that number grew to 53 million. And today, we have over 63 million Americans providing family care. That's nearly a 50% increase in just 10 years. Let that sink in. That the growth in family caregiving has been dramatic, and our systems have simply not kept pace. 63 million, and we really see that as the floor, not the ceiling, on Americans providing care in this country. In fact, when we cast the net wider and incorporate parents providing care for children, that number grows to over 130 million. But that 63 million is really focused on folks providing care for people with a serious illness, a disability, or someone with age-related challenges. And this number represents 1 in 4 American adults. If you're caring for a family member or friend, you are not alone. You are part of a large and growing community. Look around this Zoom room and you'll see that community in action right now. And here in Idaho, as we'll see in a moment, those numbers are even higher than the national average. So who are these 63 million family caregivers? What emerges is a picture that challenges many assumptions about who provides care in America. The average caregiver is 51 years old, but 2 in 5 are under the age of 50, meaning caregiving isn't just about adult children caring for aging parents. There's all different kinds of care relationships, and I'm very excited to see the focus on kinship caregiving in today's conference. It's reshaping the lives of younger Americans navigating careers, education, and families all at once. Women continue to carry a disproportionate share of the load of caregiving at 61%, but 38% of caregivers are men, a substantial population whose needs are often overlooked in program design, policy, and stories in the media, you name it. 89% are caring for relatives, 40% for parents, 15% for spouses, and more providing care for other types of relationships. 1 in 5 caregivers lives with a disability themselves, and 1 in 10 identifies as LGBTQ, and nearly 3 in 10 are sandwich generation caregivers, juggling care for both children and adults simultaneously. And what this data shows us is that caregiving truly spans every community and every identity in America. Caregiving is one of our common bonds that connects all families, all communities, every zip code, as you'll see later. And our overarching finding, when we start to delve deeper into the data across the board, is that support systems are expanding. That's the good news. But the demand for family care is growing faster than our ability to meet it. While we've seen incremental progress in areas like technology adoption and workplace benefits, family caregivers face deepening challenges in health, finances, and care intensity. Our collective efforts to support family caregivers have never been more urgent or more needed. I'm sure all of you feel the gaps in the system around support for family caregivers and the consequences of those gaps. So there might be more supports in place when we look at the population level. They're just not adequate when it comes to the scope of the challenge, and we'll explore that more throughout the presentation. And when we look more closely at what family caregivers are experiencing, we see profound ripple effects across every dimension of their lives. And I'm going to walk you through what the data tells us about these ripple effects. More than half of America's family caregivers, 57%, are in what we classify as high-intensity caregiving situations. These are families managing complex medical care, providing around-the-clock support, and navigating systems that weren't designed to help them. I'm sure many of you can relate to this reality. And this isn't about simple assistance anymore. We've essentially transferred hospital-level responsibilities to living rooms and bedrooms, and we're sending families home without a manual and without support to meet that reality. And the financial impacts are extensive. This is one of the key ripple effects of caregiving when it goes unsupported. 47% of family caregivers experience a negative financial impact from their caregiving role. 31% have stopped saving entirely due to caregiving costs. 23% have taken on additional debt, including high interest credit cards and loans in order to make caregiving more affordable. And 20% have left bills go unpaid or paid them late. Caregiving creates what economists call a double financial hit: increased expenses at the same time as reduced earning capacity, as many caregivers leave the workforce in order to provide care. And these impacts aren't distributed equally. Communities that already face economic challenges are hit the hardest, whether that's low-income households, women, and particularly women of color. And the toll on caregiver well-being is extremely concerning, and another important ripple effect that we have to examine. 64% of family caregivers face moderate to high emotional stress. 1 in 5 rates their own health as fair or poor, and 45% experience physical strain from caregiving. I'm sure that physical strain is something that many of you can relate to and grapple with every day. And perhaps most troubling is 24% of family caregivers report feeling alone. Isolation is a hallmark of the caregiving experience for so many. And that's an increase from what we saw in 2020. Even as our world has become more connected, caregivers are increasingly isolated from their support networks. And that's why I'm so glad that many of you have joined today's conference to help create a community around this really hard experience of care. And while I'm so grateful to the ICA for making this effort possible. And these pressures are compounded when caregivers try to maintain employment. 3 in 5 family caregivers, 61%, are balancing work with care responsibilities. Among working age adults, that figure rises to 70%. And I'm sure that's one of the reasons why this conference is on a weekend and not during the week, because I'm sure many of you are balancing work alongside your caregiving responsibilities. And as a result, we see impacts in the workplace. 58% go in late, leave early, or take time off to provide care. And 53% are paid hourly rather than salaried, which significantly limits their flexibility and the kinds of benefits that they have access to. Working caregivers actually take on more debt, 27% compared to 20% of non-working caregiver. The cost of managing both roles simultaneously creates additional financial pressure. This mismatch between our employment systems and family realities demands real solutions and requires policy and advocacy. Now, those are the national numbers. Things are happening at the national population level, which is important and what we're able to track over time. But I know you didn't come here just to hear about national averages. You came here because you care about what's happening right here in Idaho and in the Mountain West. So let's zoom in on this community. And it's one of the exciting parts about the evolution of our Caregiving in the US project is for the first time, we've done state level analysis and state level data collection and regional level data connection. And what we see is that nationally, 24% of US adults are family caregivers. And here in Idaho, that number is 28%. That's 4 points above the national average. That translates to approximately 418,000 Idahoans providing unpaid care to family and friends. 418,000 people. All of you, your neighbors, your coworkers, your fellow congregants doing this work often without recognition or support. I should note that where Idaho-specific data wasn't available, we've drawn on data from the Mountain Division, which includes Arizona, Colorado, Idaho, Montana, Nevada, New Mexico, Utah, and Wyoming. So who are caregivers in Idaho and the mountain region? This is what the data tells us. 66% are women, so tracks with what we see at the national average. The majority are women. A wider gender gap, though, than what we see at the national average. The average caregiver age is 54, older than the national average of 51, and the average age of the person receiving care is 65. 54% work while providing care. 46% are caring for a parent, making parent care the most common caregiving role in the region, but obviously not the only, as many of you demonstrate. And 24% are sandwich generation caregivers, juggling children and adult care at the same time. And the work the Mountain Division caregivers are doing is substantial. 100% help with instrumental activities of daily living, things like meals, medications, and managing finances. 63% help with activities of daily living, like bathing, dressing, and feeding. And nearly 50% are helping with medical and nursing tasks. This goes back to what I said earlier. We've moved so much work from hospital settings into home-based settings. And nearly half of family caregivers in your region are performing clinical level care in home settings. And these demands take a real toll on families. 45% of caregivers in the Mountain Division are in high intensity care situations, with many providing 20 or more hours of care per week. 45% experience moderate to high emotional stress. Physical strain is widespread. And 37% receive no help at all, not paid or unpaid. They are doing this entirely on their own, which I'm sure many of you can relate to that stat. 47% report a negative financial impact. These numbers tell us that caregivers in Idaho and the Mountain West need targeted, accessible support, and they need it now. But this story isn't just about struggle. Even amid these challenges, we see something powerful. 51% of family caregivers, 1 in 2, report finding a sense of purpose and meaning in their caregiving experience. This isn't denial or resignation. It's something more fundamental about the human connection and family. Caregivers aren't asking to escape their responsibilities. They're asking for sustainable ways to fulfill them. The purpose they feel they find in their role becomes a source of resilience, but it shouldn't be the only thing that sustains caregivers, right? Caregivers can't live on resilience alone, on purpose alone, but this demonstrates the tremendous meaning making that comes from care, the joy that can come from care when it's supported, when it's recognized, and when it's valued. And that future is possible. That reality is possible. And that's where we have to celebrate progress when we see it. And there is progress to celebrate. In our data, we see that technology adoption among caregivers, particularly younger caregivers, is surging. Remote monitoring has nearly doubled from 13% in 2020 to 25% in 2025. And support networks are growing. 53% of caregivers now have unpaid help in their network, and 11 million family caregivers now receive some form of payment through programs like Medicaid as part of their caregiving role. Long-range planning is increasing, with 47% of caregivers now reporting that they're planning for their own future care needs. These developments point to both caregiver resilience and the potential for systematic change when policies catch up with family realities. So where do we go from here? One obvious thing that I'm sure many of you see is that the policy landscape is shifting, and there are both challenges and opportunities emerging. Let me share what the data tells us about what caregivers actually want and what's happening at the policy level. When we ask caregivers what would actually help in making their care more sustainable, we hear practical responses. 1 in 3 caregivers want respite services. It's a single most requested form of support. Time to recharge, time to be something other than a caregiver, even for a few hours, time to go to the grocery store, to go to a doctor's appointment, time away from care where you're supported. 2/3 would benefit from payment programs, especially lower income caregivers providing intensive care. 2/3 also want income tax credits, which are particularly helpful for caregivers earning $50,000 or more annually. And 1 in 3 want needs assessments, healthcare professionals evaluating their own support needs. That basic acknowledgement of saying, how are you doing, would represent a fundamental shift in how we integrate caregivers into healthcare teams and how we ensure that they're referred to services that they're eligible for. And now let me turn to the policy landscape, because there are some critical developments that directly affect families in Idaho and in the region. And on the challenges side, we're facing up to $1 trillion in Medicaid cuts and proposed work requirements that would create new barriers to access for both caregivers and the people they care for. But there's an important opportunity here. Family caregivers have been identified as a population exempt from proposed work requirements. That's a critical policy win for our advocacy communities. For the first time in legislation, Congress has recognized caregiving as work. And as a result of that, family caregivers, and while there are a lot of barriers and challenges and implementation issues, could be exempt from new work requirements and what CMS are calling community engagement requirements. And it happened because people spoke up, that people talked about the realities of care, the importance of access to home and community-based services, the kinds of services that Medicaid makes possible. And also, with to keep in mind that nearly 8 million family caregivers rely on Medicaid for their own healthcare coverage. So the stakes are really high when it comes to Medicaid, and this win is really critical. And I'll talk a little bit more about how all of you and ICA and others can get involved to make sure that we leverage that exemption to avoid coverage losses and losses to essential services. On the Medicare front and federal funding, there's also a mix of progress and concern. New Medicare reimbursement codes now allow healthcare professionals to be paid for identifying and training family caregivers, which is a significant step forward. As I mentioned earlier, over half of family caregivers in Idaho are navigating complex medical and nursing tasks. I'm sure many of you have experienced this, whether it's changing a feeding tube or a PICC line or engaging in complex medication management. I'm sure many of you didn't receive training for that. Instead, you probably YouTubed it, or you asked someone else, right? But now healthcare providers can be reimbursed for providing training, which is a small but meaningful step in the right direction. And new CMS innovation models are beginning to incorporate caregiver support, like the GUIDE model, which is around Alzheimer's and dementia-related care. For the first time, we'll include things like respite care, so providing caregivers with actual dollars in order to pay for respite care, caregiver training, caregiver health risk assessments, really an innovative approach to recognizing the value of caregiver contributions alongside patient outcomes. And on the federal funding side, we've seen, even in this environment of massive cuts at the federal level, modest increases in caregiver-specific programs like the National Family Caregiver Support Program and the Lifespan Respite Program and the National Strategy to Support Family Caregivers have all received modest increases in the last budget negotiation that was finalized just earlier this month. But funding is not keeping pace with the scope of the challenges. These systems are being shaped right now, and caregivers need our advocacy to ensure that they reflect the reality of the 63 million Americans providing care. So what can you do with everything that you've learned today? I want to leave you with some concrete resources for action. First, the data itself. We've developed state-level data through our companion report, Caregiving in the U.S. 2025, caring across states.
Idaho has the TV's on.
Idaho has over 400,000 family caregivers, as I shared, and this report gives you the numbers to tell their stories, the numbers to find community. So I encourage you to access this report with the QR code on your screen. can use this data in grant applications and conversations with policymakers and media outreach in your own program design for those of you who are service providers. These aren't just numbers, they're tools for advocacy and for public awareness. And for family caregivers, they're a reminder that you're part of a larger community and a bigger picture when it comes to care. And second, there's an urgent action item that I want to flag. The Older Americans Act needs to be reauthorized. This is essential infrastructure for providing support, whether that's meals, like Meals on Wheels, transportation support, caregiver training and education. The Older Americans Act is what helps to make those programs possible, and it's up for reauthorization. And so we at the National Alliance for Caregiving and through our Caregiver Nation Coalition are asking folks to call their members of Congress to urge that they reauthorize the Older Americans Act. And we have created resources to help you do that. So this QR code, and I can share this with Edwina and folks to share the links afterwards, will take you to resources that give you, really turnkey templates to send letters and to make calls to your members of Congress, which I encourage you to do, especially if you receive support through things like Meals on Wheels, or if you participated in a caregiver support program in your local community, you receive services through the local area agencies on aging. Older Americans Act makes all of that possible. And third, as I mentioned earlier, as the budget reconciliation process moves forward, we need more voices at the state level championing the need for family caregiver exemptions from Medicaid work requirements. And we need you to educate state policymakers about the importance of Medicaid home and community-based services for family caregivers. The Caregiver Nation Coalition, which we lead, is organizing advocates across the country on these issues. And again, this QR code will take you to resources where you can learn about ways to email your state Medicaid director and ask, hey, we hear there's a caregiver exemption. How are you at the state level making sure that caregivers qualify and are exempt from these new work requirements? And I want to take just a brief moment to recognize all the folks that make this work possible, the research that I shared with you today, including one of our common friends and supporters, the Cambia Health Foundation and others. Without this community, we couldn't make this impact possible. And I want to close with a quote from the great disability rights advocate and activist Judy Heumann, who is one of my heroes in advocacy work, who said, "Change never happens at the pace we think it should. It happens over years of people joining together, strategizing, sharing, and pulling all the levers they possibly can." And I think that's exactly what you're doing by being here today, by showing up as family caregivers, as allies of family caregivers, by sharing your stories, by accessing resources and learning about resources. You're recognizing that while it's much too hard to care in this country, that care has value, that our voices have value. And over time, it's those kinds of changes, those kinds of decisions that you make every day to show up, to be present, that add to change over time. So in closing, the data that I shared with you today tells a clear story. America's 63 million family caregivers, including the more than 400,000 right here in Idaho, are the backbone of our care system. Yet they're operating without the support and infrastructure they need and deserve. But this isn't just about understanding the problem. It's about recognizing the opportunity. Every challenge we've discussed represents an opportunity for innovation, for partnership, for policy change, for storytelling. The tools, the data, the networks, the community that you're building in this Zoom room and in the conference rooms and watch parties across the state is where change will happen. So you now have that understanding of the bigger picture, the bigger community, and I hope that you take that to heart. I'm incredibly grateful for your contributions, the work that you do every day to care for the people in your lives. It matters, it's important, and it's what makes us human. It's what makes love possible. what makes community possible. So thank you for the opportunity to share a little bit about our contribution to this movement, and for the opportunity to thank all of you and be with all of you today. I'm happy to answer questions, and I will turn it back over to Sarah.
So did I not tell you he was like movie star, rock star kind of quality? Jason, thank you so much for joining us. I really appreciate your laying out this, creating a common bond. We are not in this alone. We are so much better together. And I think you highlighting the 418,000 caregivers in Idaho is spot on, the millions across the country. So appreciate your message. One question I have for you, just to kick off the discussion. So as part of our audience, you may have seen some of the chats. We have quite a few members of the families, individuals who serve in a certified family home relationship. So they do receive a small amount of remuneration for that. How is that population captured in the surveys that you do in the work?
Absolutely. So one of the things, and that's a really essential part of the care system overall, right? Sort of like there's a system of care that includes family caregivers and direct care workers and home health aides. I mean, you name it, that make care possible. That and holistically is undervalued. What we see in our data is that over 40% of family caregivers have access to some form of paid support. So I think that's where that would fit into the equation. And what we see is when families have access to paid support, they're able, they have less, emotional stress, less, trouble coordinating care in some instances. So really, it adds to the sustainability of care situations when you have access to that paid support. And we know that access isn't, easy. When we see so many policy changes, but paid care supports and the folks that provide that paid care are really essential to the care system, and why we think it's important to ensure that we're valuing those jobs, that those jobs are paid, those folks are paid a living wage, and that they have predictability in their schedules, and more families have access to that kind of support if it makes sense for them. Right. So I think it's about options. Some families, want the option to have paid support. Some families want to be able to provide that support on their own. For other families, an institutional support might be the best path for them. But right now, we're not giving families options. We're really making changes to policy that pushes people in one direction or the other, or doesn't give them access to something like paid support in the home. And the last thing I'll say is we see some family caregivers who have access to a form of remuneration. And so they're kind of in the gray area of being a family caregiver, but then also a paid caregiver because of state programs. And we know that many of those state programs are starting to change. And we've seen that in Idaho when it comes to self-direction and the kinds of families that are able to take advantage of self-direction.
Yeah, I think our umbrella is pretty broad here in the Idaho Family Caregiver Alliance, and we welcome that whole range of caregivers. We often talk about, and I hope this isn't sound any way disparaging, but it's the unpaid family caregiver, it's the underpaid family caregiver, which can be direct support, certified family homes, that is the voice that we feel is really essential to keep at a forefront in policy discussions. And
absolutely.
Yeah. So yeah, we encourage you, if you have a specific question for Jason, please add them to the chat. I think, as you can tell, he's very knowledgeable about many things.
It looks like Dan and Marty have a question. Do other states provide something similar to certified family homes here in Idaho? Yeah, I guess how common is that nationally?
Yeah, I think states have different kinds of structures, but I think definitely, and I think there's opportunities for thinking about learnings across those states. And I think those states are also feeling the ripple effects of some of the national policy changes that are happening through the Medicaid program. And so there are great organizations like Advancing States that are really looking at that intersection between the direct care workforce, whether that's through programs like CFH, or the Structured Family Caregiver Support Program, which is in 8 other states that has a not exactly the same, but some similar elements to CFH. And so definitely states are taking efforts to tailor responses to the challenges they see when it comes to providing care. And I think what we see across the board is like all of these programs are fragmented and have their challenges in terms of sustainability over time because of the scope of the care challenge, right? And when we talk about the 400,000 families in Idaho, we really see that as an undercount, right? That's a floor, not the ceiling on the number of folks providing care in Idaho. And so I think all these programs are stretched to capacity.
Yes. Yeah, I think this is an opportunity to actually to applaud, celebrate the Idaho Division of Medicaid. Idaho was one of the first program or states to embrace the certified family home model, and for a variety of reasons. But one, I think that seeing the value of being able to enable family to stay together. And we have a very talented individual who leads that program, Stephen Millward, who is often joining us for this conference. We don't have him on the agenda this year, although we have his boss on the agenda at one of our breakouts. But I think the certified family home here in Idaho is really a key component of that. But Jason, as you say, it's really fractured and it's not easy to become. I mean, it's kind of expensive to become a certified family home. So there's work to be done, but we have a great foundation, and I think it works here in some capacity, but certainly work that could be done to extend that.
Absolutely.
There's another question in the chat from Tina. Do you have an office in Idaho? And then, how do you get your information besides surveys when you collect information?
Absolutely. So we're a national organization. So we're based in Washington, D.C. And we don't have an office in Idaho, although I wish we did. We get our information from through lots of avenues. One is our major initiative is this Caregiving in the U.S., which we do every 5 years in partnership with AARP, and are doing extensive oversamples at the state level and in different communities. And then we have a process for what we call caregiver-centered listening, where we're connecting with family caregivers across the lifespan around specific issues, whether that's within cancer care or around Medicare supports, or we're having focus groups and insight exchanges so that we're capturing qualitative lived experience data alongside the quantitative data that we capture in our surveys. And then we have online, even though we don't have an office in Idaho, we have a storytelling platform where, and I can put this in the chat, where we encourage family caregivers to share their stories with us. And I know that sounds so cliche at this point, but I have to tell you how powerful it is to have stories to be able to bring to life these policy issues and the boring data that I share sometimes, right? We say data makes us credible, but stories make us memorable. So we have this platform that collects stories and then organizes it by state. And so we have a map, and you can look up stories by state and also by different condition areas, whether that's related to cancer, disability. So I'm happy to share that in the chat. And then we leverage those stories with the permission of the caregivers to help to contextualize our research during the policy advocacy work around things like the Medicaid program. We had a lot of interest from reporters and policymakers. So we would contact folks that shared their stories. And there's one amazing example of a mom in Idaho who's providing care for her children with intellectual disabilities, who was able to leverage self-direction, and that program was getting cut. And so we were able to engage with her to tell her story and do media appearances, to engage policymakers. So there's a really powerful connection between the data, the storytelling, and the advocacy work that we do.
That's exciting. And
people are interested in the chat about sharing their story, so that's great.
That would be wonderful. We'd deeply appreciate that.
Yeah, another message in the chat that I think it would be interesting to have you respond to is your role at a national level. You really see a much broader access to information that other states might be doing. Are there states where health systems or public health entities have been able to create structures to effectively identify, train, and support caregivers in a systematic way?
Yeah, that's a great question. And I think that all states are grappling with how to do that better. Some states are more advanced in doing that in terms of like how they are structured, in terms of like their public health and aging departments, how they are integrated in some states, and then that creates some synergies. And so there's a great resource that our friends at AARP, and I don't know if anyone from, I'm sure AARP Idaho, some folks are here, but they have something called the LTSS scorecard. And a dimension of that scorecard is caregiver supports. And so you can see how states stack up to caregiver supports. And a state like Minnesota, for example, has done a lot in terms of putting in place policy infrastructure around caregiver supports. That's like paid family and medical leave, paid sick leave, alongside hospital discharge policies. And so certainly there are states, I'd say Minnesota is a good example. California is another good example. And then you have some states who are just really behind in catching up with the reality of the population in their communities. And one of the things we looked at was caregiver prevalence. So, and also spending on long-term service and supports and home and community-based supports. And what we see is some states, particularly in the American South, high prevalence of caregiving, low spending on home and community-based services. So there's big gaps at the state level in some areas, but definitely some opportunities to learn from states like Minnesota. So I encourage looking at the LTSS scorecard and give for some examples of states that are really stand out.
Yeah, that's good guidance. Idaho is not high on the list as an example of scoring well there, but it gives us opportunity to change. And Jason, I think this looking at a systematic or across systems approach is one of the roles that the Idaho Caregiver Alliance has really worked to create. Is we have partners, wonderful partners, but they're really tied into a funding stream that is age specific or condition specific. And so what our work is really, how do we pull maybe just a little bit of that energy to thinking across something that they all share, and that is the family caregiver. So it is an ongoing challenge and opportunity to how do we knit that.
I think that's a great point. And I hope that and I'm glad that you I appreciate your perspective on that, because it's not about we're worse than this state. It's more about like just where you are right now in your development infrastructure. And I think that is an opportunity. And it's also an opportunity to think differently. So to your point, right, you have a different circumstance in Idaho, and many states, have developed state caregiving plans. And I think that's a great thing to look at, because that gives you the opportunity to look across conditions and outside of just the aging silo. Because I think this community, the folks around the Zoom room, really demonstrate that caregiving is a life force issue, right? And it comes in all different forms. And so often it's just couched as an aging issue or as an Alzheimer's issue or as a cancer issue. But really it cuts across, and a lot of the challenges are similar. And, every experience is unique, but the systems that are failing are, all part of the same issue. So I think looking at some states who have established caregiving plans are a good way of doing that. In some states, the governor has established that. In some states, the legislature has established mandated a caregiving plan. And then some states have really taken that across the lifespan approach. So that's something I would recommend that ICA look at. And then I'm sure that there are opportunities to leverage infrastructure. So many states, like California is a great example around the California aging plan. And in Illinois, there's an aging plan. Illinois is a great example of they made caregiving a core part of their aging plan. And it's a reality that everyone's aging. So if you're, providing care for, someone with a disability now, that person's going to age, right? Your age. So like there's opportunities to, even though the funding stream is through aging, to really leverage that for driving these life course conversations.
Yep, agreed. This is very preliminary, but we are in some initial conversations about the development of a foster care kinship family state plan for Idaho, because it really is a scattershot approach, and we need a roadmap so that folks are all rowing in the same direction, driving in the same direction. So hopefully, that's an area where, as an entity that's outside of a governmental structure, we have that flexibility and ability to move those things forward that I know folks inside those organizational structures want to, but often have their hands tied to do that type of work.
Absolutely.
So yeah, I think it's a nice shared partnership, and we certainly enjoy the trust that folks have in the Caregiver Alliance to work on their behalf and work with organizations, not in opposition or duplication. Jason, there is and kind of thinking about wrapping up the conversation here, there's a positive a question that's very thoughtful, I think, in the chat. You mentioned that your mother was a sandwich caregiver, and the caller was asking, so what were the attributes of your mom that you saw exemplified as she juggled those roles of a sandwich caregiver?
Oh, I love that question. Thank you. I'd say it certainly taught me what fierce commitment looks like to family, and also that the impacts on care, right? So like my mom had a dream of becoming a certified public accountant, but that dream took a backseat to her care responsibilities. And so that was a dream that went unfulfilled. But she still, showed up and did the best that she could, and, tried to make sure that she was still able to have some professional fulfillment while she made sure that she was showing up for my grandmother and for us. And so adaptability, right? Sort of solving dreams, I think, right? Sort of like, she had to adjust that dream, but, new dreams came to fruition, like me graduating. I was the first person in my family to graduate from college. And that was a big part of, her sacrifice that made that possible. So that fierce determination, that adaptability, I think really taught me about what care in action looks like. And also that even, this is something we see in our data, but even with something so challenging as caregiving, right? There are very hard days, and I certainly saw my mom navigate those hard days. I mean, my grandmother had multiple chronic conditions, had an amputation, and there was a lot of adaptability around mobility, and just, it was rough. And my mom, the first time I ever heard my mom use a 4-letter word was when she was on the phone with my grandmother's insurance company. So I saw all the aspects of care, but I also saw the joy of dancing with my grandmother in a wheelchair, and her, cutting corners and wanting to race us in a wheelchair. So in the midst of all that hardship and that challenge, there was still joy, right? And I think that really taught me a powerful lesson about care.
Powerful lessons, you're right. And certainly we can see it exemplified in your passion and your work that you do through NAC. Thank you so much for that. Yeah.
Absolutely. Well, thank you. I really appreciate your leadership for creating this community, and most importantly, to all of you who took time away from care to show up today, to be in community, to look for access resources. That I think is how we make care sustainable and how we make the world understand that this work matters, this work has value. So thank you so much. It's a pleasure to be with you.
Again, thank you. And I think a hearty round of applause to Jason. Thank you so much. So we mentioned at the outset of the meeting that we were going to be giving away gift cards, and I have